The devastating effects of concussion of the brain are relatively recently coming to the attention of the world at large. Will Smith, in his role in the movie Concussion, as the physician identifying the neuropathological damage to brain tissue and the uphill battle to publicize the disease, will help. Like cigarette smoking in teens and young adults, the most severe damage to the body isn't noticed until years after the tar and nicotine-induced damage. The resultant cognitive changes from concussion that develop in its victims impair the ability to think, speak, and act normally, often in later life. Hi, I'm Dr. Dave Campbell again, bringing you information about concussion, this time so that as many parents as possible can know the signs of concussion in youth and young adults, their children, and assume the responsibility of reporting to the coach or trainer when they notice it. For with age comes not just gray hair and weight control issues, but wisdom and responsibility. Youngsters will not report to you, the coach or the trainer, when they have had their bell rung. The mindset of youth and college athletes will keep them from speaking up. They want to play, not sit on the sideline with the trainer holding their helmet or their shoe to keep them off the field. Parents, listen up. It is your responsibility to identify the signs of concussion and to report them to the coach, trainer, team physician, anyone or everyone. In the situation of concussion, be that parent. Yes, the parent that everyone thinks is a pain in the rear end. It is important to be able to recognize a concussion after a head injury in an athlete. Failing to notice may lead to permanent and severe brain damage, prolonged cognitive disability, and even death. A concussion of the brain is a transient alteration in mental status that may or may not be associated with loss of consciousness from a direct blow to the head or an indirect force, which causes the brain to slam against the hard bony shell of the skull. Think of the analogy of an egg yolk, how it hangs in the middle of the egg white surrounded by the shell. That's a brain. Watch your kids for a headache. Try to notice a cognitive change. Are they acting weird? That is, weirder than normal. Are they talking goofy, dazed, or glazed over? Are their eyes wandering around? Eyes normally should track symmetrically. With a concussion, the youngster may look like a gecko with their eyes all goofy, besides their speech being goofy also. Balance can be off because of vestibular damage. If the blow to the head is enough to damage the brain, it can also knock around the inner ear structures. After a game or practice, a concussion may cause sleep or mood disorders, fidgeting, restlessness, feeling off. Migraine headaches can be triggered by concussion. In 2014, the National Athletic Trainers Association reported that concussions occur in up to 3.8 million athletes per year, both reported and unreported. In college, men's wrestling and women's ice hockey led the field in rates of concussion. On the field, some of the signs of heat exhaustion and even the more deadly version of heat illness, heat stroke, can have signs which overlap with concussion. So on hot, humid, or muggy days, or if the youngster is not heat acclimated or poorly hydrated, watch for both heat illness and concussion. The kids will not tell you if they have had their bell rung or if they do not feel right. You as a parent may think that modern medicine must have a blood test, scanner, or some type of biomarker to measure concussion. Sadly, you would be wrong. The only tools to measure functionality of the brain are neurocognitive tests. The best way to measure the deleterious effects of concussion on brain functioning is to have neurocognitive testing prior to injury as a baseline, and then repeat the same testing after an injury looking for changes. Some of the more useful neurocognitive tests look at ocular and vestibular functioning. For the eyes, it is assessing visual motion sensitivity, that is eye movements, and what is called convergence. Bring your finger towards your nose while staring at it with both eyes. That will give you an understanding of convergence. The kids will call it the cross-eyed test. For the inner ear vestibular functioning, as part of neurocognitive testing for concussion, it is the ability of the injured athlete to stabilize their vision when they move their head. As a parent, you are aware of the pressures to keep playing placed on the athlete, whether youth football, high school or college, school finances, scholarships, ego, peer pressure, coach pressure, public visibility, and sports competitiveness. These are all variables that play a role in the possibility that an athlete will sustain repetitive brain injuries, leading to more and more risk of permanent damage to the delicate brain tissue. 80% of athletes recover from concussion through rest alone, but the timing varies widely. Weeks or even months can pass before the youngster or even college player has recovered completely. A recent body of scientific knowledge is showing that complete rest and isolation after a concussion is not the best way to manage the injury. A stepwise return to normalcy, doing things the athlete feels comfortable with and that do not cause a return of symptoms, seems better. Of course, that does not mean going right back to the contact sport as soon as the kid says they are okay. Concussions need individual management because they manifest differently in different athletes. Everybody is a little different. Every concussion is a little different. So, parents, watch your kids and watch your neighbors' kids and contribute to the future mental, physical, and emotional health of all youngsters under your influence. Thanks, Dr. Dave Campbell.